Well, I have good news and bad news. Have a seat, won't you? The bad news is you have asthma, an incurable and potentially life-threatening disease. The good news is, excuse me. Yes? Uh-huh. Okay, I'll take care of it. The good news is, with over 300 million people affected worldwide, asthma is actually quite a common disease, and a great deal is known about it. It's not infectious, it's rarely painful, and it can now be so effectively controlled that your quality of life is almost normal. If, that is, you and your doctor as partners take the proper steps to manage the disease.
Sorry to interrupt, Dr. Sebastian, but you are late for your rounds.
Oh, right you are. You can come with me. We'll talk on the way. You know, asthma is not a disability, but rather a condition, an inflammation of the lungs. Here, let me show you. In a non-asthmatic lung, these airways are clear and open. With asthma, however, inflammation results in a narrowing or constricting of the passages, which decreases the amount of air that can move in or out of the lung. In an acute asthma attack, the airways become increasingly blocked, causing inflammation, causing breathing trouble. There are two kinds of medicine that most asthmatics use. The first one helps with the seriousness of your asthma attack. This is called a reliever medication. However, with daily use of the other, the so-called controller medication, which reduces the inflammation, these attacks can be avoided in the first place.
Dr. Sebastian, if you don't mind, the time.
Oh, of course. Doctor's work is never done. A few years ago, I had much more time for my patients, but now, as you can see, everything is rush, rush, rush. Fortunately, and this is even more good news, there's another source of help available. Your fellow asthmatics. You see, I may be an expert in treating asthma, but they are experts in living with asthma. Naturally, none of them is qualified to give you medical advice, but you'll be surprised at how much they can help you in living with asthma. These asthma peer groups meet regularly to talk about their experiences. In fact, this one's meeting tomorrow night. Here's the address. Yes?
It's Paul. I have good news and bad news. The bad news is, I'm afraid we can't save it.
Are you sure?
I'm afraid so.
And the good news?
As it happens, I have another engine in stock for exactly this type of car.
I see. And what's it going to cost?
Are you sitting down?
If you'll excuse me, I think I'd like to be alone right now. Go ahead.
Thank you.